Lesson 7 covers infection control and aseptic technique. Healthcare-associated infections, sometimes called nosocomial infections, are among the leading preventable causes of patient harm. As a radiographer, you work with patients who are immunocompromised, post-surgical, and critically ill. Your infection control practices directly affect patient outcomes. Let's cover it. Every infection requires 6 links in a chain. Break any link and you prevent the infection. The infectious agent, bacteria, virus, or fungus. The reservoir, where the pathogen lives, often the patient. The portal of exit, how it leaves the reservoir. Sneezing, coughing, open wounds, bodily fluids. The mode of transmission, how it travels. Contact, droplet, or airborne. The portal of entry, how it enters a new host. Mucous membranes, breaks in skin, inhalation. And the susceptible host, a person without adequate immunity. Hand hygiene breaks the chain at the mode of transmission, every time. It is the single most effective infection control measure in healthcare. The World Health Organization's 5 moments of hand hygiene defines exactly when hand hygiene is required. Before touching a patient, before any clean or aseptic procedure, after body fluid exposure risk, after touching a patient, and after touching the patient's surroundings, the bed rail, the call button, the imaging table. Wash hands with soap and water when visibly soiled or after caring for a patient with C. difficile. Use alcohol-based hand sanitizer for all other moments. Sanitize for at least 20 seconds. Wash for at least 40 to 60 seconds. Gloves do not replace hand hygiene. Sanitize before putting gloves on and after taking them off. Standard precautions apply to every patient, every encounter, regardless of diagnosis. Treat every patient's blood, body fluids, secretions, and non-intact skin as potentially infectious. Standard precautions include hand hygiene before and after every patient contact. Gloves when contact with blood or body fluids is anticipated. Gown when splashing is possible. Mask and eye protection for splash risk to the face. Respiratory hygiene and cough etiquette. Instruct patients to cover coughs. Offer masks for symptomatic patients in waiting areas. And safe handling and disposal of sharps. Never recap a needle with 2 hands. Dispose immediately in a puncture-resistant sharps container. Beyond standard precautions, 3 transmission-based categories. Contact precautions for infections spread by direct contact. C. Difficile marassae, wound infections. Gown and gloves for all contact. Dedicated equipment where possible. Prioritize hand washing with soap. Alcohol gel does not kill C. diff spores. Droplet precautions for infections in respiratory droplets. Influenza, meningitis, pertussis. Surgical mask required when within 3 feet of the patient. Airborne precautions for infections in aerosolized particles that remain suspended in air. Tuberculosis, TB, measles, chickenpox. N95 respirator required, fitted and seal checked. Negative pressure room required. The patient wears a mask during transport. 3 levels of microbial kill, and the level required depends on the intended use of the item. Sterilization destroys all microorganisms including spores. Required for instruments that enter sterile tissue or the bloodstream. Surgical tools, biopsy needles. Methods include steam autoclave, ethylene oxide, and hydrogen peroxide plasma. High-level disinfection destroys all organisms except high numbers of spores. Required for semi-critical items that contact mucous membranes, endoscopes, laryngoscopes. Agents include glutaraldehyde and peracetic acid. Low-level disinfection kills most bacteria, some viruses. Used for non-critical items that contact intact skin. Imaging table surfaces. Blood pressure cuffs, positioning sponges. Between every patient, every time, the imaging table, the bucky, positioning sponges, and any surface the patient contacted must be disinfected with an appropriate agent at the correct concentration and contact time. Contact time matters as much as the product. A surface wiped and immediately dried has not been properly disinfected. The disinfectant must remain wet on the surface for the manufacturer's specified contact time. For portable equipment, the cassette or detector, the portable unit itself, and the exposure cord must all be cleaned between patients, including patients in isolation rooms. Know your facility's approved disinfectant list and the contact times required. This is an infection control audit point and a regulatory requirement. 3 infection control questions in the ARRT format. The answer is B, gown and gloves. Contact precautions require a gown and gloves upon entry to the room of any patient colonized or infected with an organism spread by direct contact. MRSA, C. difficile, VRE, scabies, wound infections. An N95 respirator is required for airborne precautions, tuberculosis, measles, chickenpox, not contact. A surgical mask is for droplet precautions. MRSA spreads by direct contact. Gown and gloves are the correct barrier. The answer is B. Wash hands with soap and water. Alcohol-based hand sanitizer does not effectively kill Clostridium difficile spores. Soap and water physically remove spores from the hands. After every C. diff patient encounter, soap and water is mandatory. The answer is C. N95 respirator in a negative pressure room. Tuberculosis, TB, is transmitted by airborne particles that remain suspended in air. Airborne precautions require an N95 respirator, fit-tested, not just a surgical mask, and a negative pressure isolation room with the door kept closed. You covered the chain of infection, hand hygiene, standard and transmission-based precautions, sterilization and disinfection levels, and equipment cleaning protocols. Infection control is every patient, every encounter, no exceptions.